Welcome to the latest episode of Quarantine Chronicles from the Archives. I'm Rose Guerrero, Research Director for the Historical Society of Palm Beach County. And today we're celebrating World Health Month. So, grab your favorite beverage, sit back, and let's learn something new. An important medical professional in Palm Beach County history is Dr. Clarence Brumback, or Carl, as he liked to be called. Carl was born in 1914 in Colorado. He was raised in Kansas, where he went to medical school at the University of Kansas. During World War II, he served in the U.S. Army Medical Corps. He continued as a reserve officer for many years. After World War II, he came down to Palm Beach County as the first director of public health, a position held until 1986. Dr. Brumback had numerous health problems to tackle when he came to Palm Beach County, including those only found in tropical and subtropical areas, such as malaria and yellow fever. One of the first problems that Dr. Brumback addressed was polio, which was an epidemic here in Palm Beach County. What is polio? Polio, or poliomyelitis, is a disabling and life-threatening disease caused by the polio virus. Polio was greatly feared because no one knew how it was spread, and it caused many deaths and paralysis. Paralytic polio affected people of all ages, including Franklin D. Roosevelt, the 32nd President of the United States. Because of polio, there were wards full of iron lungs to help those suffering from respiratory paralysis. Because the county had no sewage collection or treatment, Lake Worth Lagoon had become a health hazard, which was causing the spread of polio. Dr. Brumback focused on educating the community and establishing a sanitary district. Dr. Brumback also arranged for Palm Beach County to participate in testing the Salk polio vaccine. In his own words, Dr. Carl Brumback explained why public health was so important to him. I was aware of the fact that healthcare in the United States, particularly back in those days, didn't reach people who needed it. And certainly quality care was not available, accessible, or acceptable to people in those days to a large extent. Some of them had little or no care at all. Also, the idea of prevention appealed to me greatly. The concept that we don't need to suffer from a great many of our health problems as we do if we use knowledge of prevention. Carl entered public health because he wanted to prevent illness. Another health issue that Dr. Brumback noticed was that racial segregation prevented everyone from receiving quality care. Dr. Brumback wasn't just a champion for health care, he was a champion for everyone to receive health care, including the African American communities. Dr. Brumback enlisted 2 African American public health nurses to address this problem. Eva Williams Mack and Bessie Diet helped Dr. Brumback tackle the problems in the Black community. Who was Eva Williams Mack, and why was she so important? Eva Williams Mack was born in Alabama, got her nursing degree from Simmons College in Boston. She moved down to West Palm Beach in 1948 to work as a public health nurse. She became the first Black mayor in the city of West Palm Beach in 1982, and she served 2 one-year terms. She became the first health specialist for the Palm Beach County School Board. She also founded the Sickle Cell Disease Foundation of Palm Beach County in 1979, after she and Ruby Bullock became the first Black city commissioners of West Palm Beach. We have to thank people like Dr. Carl Brumback and Eva Williams Mack, who were trailblazers for public health here in Palm Beach County. Well, thank you for sharing in these Quarantine Chronicles from the Archives. I hope you've learned something new today, and if you want to find out more, check us out.